Hello, Mark. Thanks for joining our podcast, DHIL, or Digital Health Innovations for Long Life. DHIL also means heart in Hindi. So, welcome to DIL. Uh, First
Thank
things
you, Drew.
first, I think
Yep.
if you can please introduce yourself and then let us know what you are doing now, I think that would be a great start.
Okay. Yeah, well, thank you very much for the opportunity to talk to you around design, especially in digital health. Yeah, my background is from a place in the what they call the Antipodes. From a European perspective, the other foot is what Antipodes means, and it really is Australia, this continent down south that no one knew about until quite recently. So I've grew up in Victoria in Australia, the southern state, born in the mid-50s, and have been practicing since about 1980 through to now in various facets between education as an academic and practice as a practitioner. So I class myself as a pracademic. Yeah.
That's a new word that I'm hearing now from you, I guess. But if you can go back to the very beginning, and well, maybe 100 years before.
100 years before. Look,
uh,
all British Isles.
uh,
So
so,
I'm half Irish, quarter Scottish, 1/8 Welsh, and 1/8 English. So the English is the Watson bit, but I don't really associate much with the English side. It's more the Irish side that I align with.
uh, so from there, when were you born and where were you born, Mark?
Okay, as the mid 1950s, 1956, in Melbourne, in Victoria, Australia. So 1956 was a significant time in Victoria because it's the Melbourne Olympics and the Melbourne Cricket Ground, which most Indian people know uh, as a landmark within Victoria, as the was the main stadium for the 1956 Olympics. But being a newborn, I didn't see much of the activity in 1956.
So, where did you go to school then? In Melbourne, or did you move
Uh,
around anywhere?
yeah, look, it's a small town just out of Melbourne, northeastern suburbs, about 10 kilometres from Melbourne City, called Heidelberg. It's actually a famous arts area because it's on our main river that goes through Melbourne, called the Heidelberg School of Art. It was an impressionist school, so it's a very scenic sort of location, Heidelberg. So I did primary school at Catholic. So being Irish, Catholic was the only brand of choice. So I've gone through the Catholic system, but I transferred across to the high school system, the public system, in the mid '60s through to early '70s. Uh, Took a sabbatical for about 3 years actually working in medical supplies. I was a traveling sales rep for a group here called Ramsay Surgical, and I used to sell catheters to cardiac surgeons. At the tender age of 19, I was gowning up and entering theatres and selling them cardiac catheters and observing procedures. So that was quite interesting. But I did a grand tour of Europe uh, in 1977, and from that helped me choose my selected path in design. So from 77 through to 81, I studied at RMIT University in the architecture faculty there, looking at interior design, but largely looking at furniture as my major in that field, furniture design, industrial design. So from that, I worked in industry for a while until I was actually invited back by RMIT. They established a first in Australia called the National Key Centre for Design, So I was one of the inaugural invitees to come back to do research, because at that point in time, not too many designers participated in postgrad. We were all too busy out there working and solving the problems of the world, and academia wasn't really seen as the beneficial side. But so I sort of finally finished up with that in 1999. I think they bestowed the floppy hat on my crown, and I've been sort of playing in that design research area ever since. So,
Wow, that's a very long and a very interesting background and a career path. So you are like traveling a lot in the so-called swinging 60s and 70s, selling catheters to. I mean, at 19 years, that's a huge challenge, I guess.
yeah, it was very interesting. But I found all the medical folk very approachable and amenable. So they put up with me, and I tried to help them as best I possibly could. But so I was never really good at that sales side of it, unfortunately. So I tended to give more stuff away than actually sell more stuff within the medical field, and helping them play with new technology and that sort of stuff. So yeah, so it was very interesting. Especially the specialist medical instrument design and development that we were doing at the time. It was very low tech, very engineering based, but it's always been an area of interest, and maybe that's something we can do at Melloretti. Okay.
And from there to furniture design through RMIT, and you are studying furniture design. I think I vaguely remember from our previous conversations that that a piece of furniture that you designed is still in the museum
Yeah, the
somewhere.
National Gallery of Victoria is my main claim to fame. So when I'm dead and buried, my grandchildren can go along and ask to see my work, and it'll be buried in a warehouse somewhere. I don't think it's actually been displayed for about 30 years, but that's down to the curator to look after all of that sort of stuff. But having something accession is quite an interesting novel concept that the government has deemed that it is something that is worth keeping for posterity, or as long as they can afford to hire the warehouses to store all this stuff. But yeah.
And that's great. I mean, perhaps like maybe if you can share a photo of that, at least we can maybe show it through this podcast, and if there's a possibility.
Yeah, I'll see what I can do in the background while you're quizzing me. So,
Okay. Um, so you are traveling in Europe, and then you came back to Australia, I presume. But during those growing years, maybe a little bit, a few things that we would like to know is when did you first get your computer? Maybe if you can talk about your first bike, or perhaps like maybe your first car, all three together.
first bike was well, actually, I did get a brand new bike for Christmas, as we do in Australia, when I was quite young, about 10 years of age or so. I got myself a smaller bike, but did most of my travelling to and from my high school on a larger bicycle, which always was a second-hand instrument. But I've never really been big on motor cars and the like. I think I told you that I bought my first motor car in about 1990 because my employer decided to move me to the factories, which was in the outer suburbs, and I had to rake up some cash for a second-hand Volkswagen. So I said, well, Volkswagens are really reliable cars. They just keep chugging away and chugging away. So I bought myself a 1972 Superbug. Was the first car that I actually bought myself. But I was lucky that I married into a motor vehicle. So my wife came with a motor vehicle, so I used that for most of my time. First computer, we in my undergrad years, which was, I said, 78 to 81, there was no computers on site, no architecture school worth their salt could really afford one. There probably was a professor somewhere tinkering away in the background playing with it, but no students got anywhere near the good stuff. But it wasn't until 1982, so 1 year out of university, that I actually enrolled in a technical college course, a short course, to investigate what's going on. And it was interesting there. That was probably a group of about 10 architects and designers that enrolled in this course. It's quite an affordable course to participate in, but the equipment largely came from geospatial surveying technologies. So obviously councils and governments were big on mapping and the like, so they had the tech. And the monitors were in 1982 about $65,000 each, and the mainframe was supposedly $2 million worth of computer, but it probably has got about as much power as your phone on that particular system. So so it was very early days. At that point in time, I was working with an architectural firm, and the boss had one computer in the practice. It was a very large practice. It was probably one of Australia's oldest practices, called Bates Smart and McCutcheon. At that point in time, it's now Bates Smart Architects. And just the lead partner was the only one that had a computer in his room, and he was just tinkering with it and not applying it. But it's really interesting with technology and the like. And I look at recessions and downturns in the economy when most architects get laid off when times get tough, and when they go to rehire you, they say, in order to get this job, you have to show us that you've done all this training in computer stuff, even though we haven't had one. But now we're all back to work, and we'll only employ the people that have done the technical training. So it's quite opportune that I had done the college course in that to sort of maintain some currency around that. But having taught in academia, sort of entered academia in about 2000 in what we call the vocational education area here, in certificate grade to diploma grade, and I was teaching computer-aided design within that course in a very basic level of operation for young designers to get a handle on it and start to explore and understand it. But I'm not CAD literate. You got to keep at it to be super brilliant at it, and it's not my forte. So I'm good at directing. So being a director, you can hire young staff and bring young people on, and you can direct them to do what needs to be done and make sure it's done right. So I have had that luxury.
You have been through this journey of seeing punch cards, floppy disks, and then the big ones, 5-inch ones, and then the smaller ones, and slowly things become smaller and smaller. And you also kind of seen both sides of it, as in the drafters carrying all these big instruments, and then slowly the computer aided design, as you just mentioned, coming over and taking over things, where now you do a lot of these things on a digital platform itself. So I think you've seen both sides of it, and perhaps like instrumental in adopting those new designs also, or perhaps like new techniques also.
Yeah, I did a paper just recently with a fellow professor at Swinburne University called Boris Eisenbart, and we were looking at AI and using design thinking as a platform to to maintain ethical practice and standard. That's everyone's big scare at the moment around that. There was an interesting meme I saw on a Nobel Prize laureate accepting just recently, and he was putting out a big warning saying AI for profit, it's not ethical. So it's a lot of debate around that. So I'm more involved in that theoretical stuff than the nuts and bolts of bits and bytes. But anyway.
A little bit more about perhaps like non-professional thing. You're also a great chef.
Great chef. Okay. I like my seafood, so but unfortunately my wife doesn't. So I have to cook most of that stuff myself. So anything to do the pescatarianism, I'm into. So yeah, so I live by the sea with a good local seafood cache. So I'm living in heaven down here by and large, but you get a bit sick of mussels. They are the crustaceans that are the food of choice down this way, and you get a bit sick of that. So yeah.
I think that's what the rest of the world thinks about Australians. Everybody lives within walking distance of the beach.
Well, it's very desertified in the middle, so middle and the north. But I was looking at there's an interesting diagram. I have to see if I can find that sometime of different ethnicities that would suit certain climate areas in Australia, and right across the north of Australia, which is tropical and steamy and hot, they're suggesting the Indian population would fit into that category quite readily. So it's yeah.
That sounds great. I mean, as long as it's still within walking distance of a beach, and if the evening temperatures go down, I think that's still great. Well, going back to the professional side of our conversation, as you are perhaps aware, we are starting up India's first school of digital health, and you have been with us here also recently. And broadly, the idea is, as we are just discussing about the transformation of architecture also from analog to a digital perspective or digital processes, I think healthcare is also going through a similar transition or a transformation. And usually healthcare is one of those areas where things change fairly a little bit late in the game rather than the first, because there are people here and any changes have to be always weighed between what is good now and if people will actually accept it, or perhaps like there's also an issue of life and death element to it. So we are now in the middle of digital transformation in healthcare. And I think at least design, it should be a design-led digital transformation, not just simply something that happens on pen and paper, directly transformed into what you call, a similar-looking pen and paper on a computer, which really does not do justice to the digital platform or perhaps the workflow also. In your opinion, I mean, with your long experience in the digital side of it, the design side of it, how do you actually start thinking about bringing design into healthcare? I mean, where do we start?
The benefit of design comes from innovation and innovative practice. And unfortunately, most of the people that end up in medicine and technology aren't from that stream. So the benefit of my practice has been in my ability to work in a multidisciplinary team environment, and that's the exciting part about me working with you at Meloridi. That's helping you to think in different ways. It's not as though I know medicine and I'm going to do something myself individually. It's us as a team sharing our knowledge and building on bits of information that helps to take people into those new spaces. So math science, very matter of fact. Art and design is quite out there, and the like. So, but I think when we did the review of longevity, when I was at Malariti in February, I was driving on empathy. I was suggesting that was the key to a strong outcome for Indian medicine. You have a long tradition of being very socially innovative and inclusive in your medical practice, and tapping into new and innovative ways of reinforcing that philosophy is the part that I'm finding quite exciting about the potential of developing work. But I think I talked about I was associated with the World Design Organization. I think we first met at a conference at Indian Institute of Business, was it, in Hyderabad? And that was the World Design Organization's meeting. Designers from around the world were coming to talk about stuff like that. The World Design Organization had a review in about 2015 of what they did as designers, and instead of just designers designing product, they expanded that purview into product, systems, service, and experience. So my key strengths are in experience, creating good experiences. So I'm really interested to look at the architectural side of hospitals and the like. Even university teaching hospitals is an exciting area of that level of experience. But talking about empathy and patient experience within those environments, but also systems and service design. We're looking at a conference in October on service design at IITH, and hopefully we'll get a poster up and have a look at villages and how they're structured. But it's looking at the service and how you can actually design it to suit populations better, rather than just design it to suit a system or an administration. Really getting down to working out what the people need and want, and looking at their pain points of the current use of the system, and seeing if we can do something better.
Well, that's true, Mark. I mean, I think perhaps like the word to focus here is on empathy, and maybe as an extension. I think when people come to a hospital or any kind of a healthcare facility, although the primary objective is that I should be perhaps like cured of a disease or get treatment, I think it should be also done in a way that I feel happy about it. The usual kind of joke is I come with pain and then I go with pain, and something happened in the middle. So that should not be the kind of way that healthcare is actually delivered as a service. If we have to kind of understand the way that we can perhaps like redesign even a hospital, as you just now mentioned, how do we actually understand how the patient actually relates to a hospital? Is there any kind of a theoretical model, or perhaps like something that we can do as part of a research to understand how the patient actually feels about the service that he is getting, or from his perspective, how can we actually bring about this kind of changes?
Well, once again, I was saying medicine works in multidisciplinary teams. So you have a whole raft of different practices and the like, between cardiac to orthopedic to whatever. You all work together as a team for a beneficial outcome. Designers work the same way too, but we work with an engineer or an architect or an organizational psychologist, or even an ethnographer. So it's bringing that team together of people who have the expertise to come together and look at the problem from a multidisciplinary perspective. So I haven't studied psychology. I only have my life experience to back up that, but professionally, to engage in research, you'd be looking at an organizational psychologist or an ethnographer to sort of come in and do some work alongside you to fill in those gaps in the knowledge that we don't understand. So it's what designers largely do. So one of the key case studies, I suppose, if you want to have a look at it, is an American group called, we'll get this right, Tim Brown was the originator of it. I'm trying to think of the name of the practice, it just caught me out. But he worked with Mayo Clinic in the US, and I think they looked at a doctor's practice or a clinician's practice, and they worked with a building group that was developing industrial design walling systems and office systems, and how to best lay out this particular group. And from that, the concepts were explored, and ethnographic research was undertaken, filmed visuals of patient movements, what it actually looked like from a patient perspective. And you're seeing lots of other case studies about people's fear of entering into CT scan tunnels, and they're looking at all different ways of what they can do to ease that tension and relieve that fear, so that people can actually participate in the processes, and not suffer that the ignominy of that alienization in that. Work with a building group that was developing industrial design walling systems and office systems, and how to best lay out this particular group. And from that, the concepts were explored, and ethnographic research was undertaken, filmed visuals of patient movements, what it actually looked like from a patient perspective. And you're seeing lots of other case studies about people's fear of entering into CT scan tunnels, and they're looking at all different ways of what they can do to ease that tension and relieve that fear, so that people can actually participate in the processes, and not suffer that the ignominy of that alienization in that process. So yeah,
Great. I think this is where, as you rightly mentioned, we can perhaps like bring a multidisciplinary team of psychologists, ethnographers, and then perhaps like uh, study and perhaps like collect data on all the things that you mentioned. But just kind of wearing my so-called digital technology hat, I think what we can perhaps do with this is maybe create a digital twin of a hospital, and then with all these inputs, we can maybe even come out with a new version of, or a new virtual version of a hospital, and then maybe do a virtual redesign, and then ask the same patient to perhaps like wear a virtual reality headset, and then go through this so-called new vision of a hospital, and maybe do a comparison. I think that looks like something that perhaps we can plan for the future.
that would be exciting for India and India's development with its rapid expansion of its medical facilities across the nation. It's something that needs to happen. So unfortunately, in the past, it's been an engineer that has largely done most of that stuff, and architects and engineers have worked together and haven't really thought too much about that hospital environment and how to create a healing place within that, and to allow the patient to enjoy the experience far more better.
Well, I think even if it were an engineer, it would have been good. But in our country, I think perhaps less the local mason would have decided how a hospital or a small clinic should have been built, and that makes things really worse. So I think the good thing is there are so many hospitals, small, big, medium, all kinds of hospitals are getting built, and there's also at least a felt demand from the hospital owners, and there are so many venture capitalists who are actually investing into the healthcare, that good experience or a happy experience even within a hospital is absolutely necessary. In fact, you mentioned about Mayo Clinic, and actually Mayo Clinic is collaborating with one of India's largest industrialists, the Adani Group, and they are actually building a huge hospital, I think, in Gujarat somewhere. And one of my friends is also associated with that initiative. So perhaps like sometime we can reach out to him and follow up on what they are actually trying to do.
Yeah.
And when I mentioned the concept of digital twins, they were also kind of fairly keen to see if there is a virtual model that can be built before they actually build a real version of it. So I think that's also one more area to follow up.
Yeah,
Um,
virtual. Yeah, the virtual generation of that. The drawings already exist. The CAD files and the architectural stuff. It's already there. It just needs to be reworked in such a way that it's usable for that particular function for moving stuff around. And we call it affinity planning. So what areas have an affinity with each other? So cutting down distances of travel from pharmacies to major areas around wards and like that, where they have to distribute their goods rather than bring the stuff hundreds of meters from other buildings that needs to be included in a system. And that kind of digital framework that you're talking about, the digital twin, is a great way to to review that. Yeah, so the group IDEO was the name. Tim Brown was the director, and they worked with Mayo Clinic. But that was probably about 10 years ago, if not longer. So,
going beyond hospitals, I think healthcare is also more and more getting into our homes, and people are living longer actually. So, healthcare is becoming more of a continuous activity. Not just a facility based healthcare, but now you have a lot of these devices that are on our wrist, maybe patches that we actually wear on the skin, and there's more and more wearable healthcare devices also coming in. So I guess this is where design would definitely play not just a key role, but perhaps like the leading role, because when you are interacting with anything on a daily basis or a regular basis, even a mild discomfort would actually create a major issue. So anything that works, people immediately forget about the technology, and it's all about how it looks, how it feels, and perhaps how usable it is. So I think there's more and more scope for design to be integrated or to be kind of adopted into healthcare. Outside of hospitals, how do we think? How do you think we can start thinking about design into healthcare, Mark?
good question. I've of the understanding that CII, the Chamber of Indian Industry, has a strong design platform. The current World Design Organization president is a former NID director in Prajuma Vyas, and they're just going through a review of the Indian legislation. India is well in advance of most other Western nations, and they've actually got an act of parliament called the Design Act, and they're reviewing that at the moment, and I'm certain having input through Prajuma into that documentation would give the necessary impetus to take that to a legislative level and to enact across a broader outreach. But it really is. It's people on the ground. It's this whole scientific research and discovery sort of stuff. It's action research, I think they call it in education. Stands for you've got to get out there and got to do it, obviously ethically and within clinical trial sort of parameters. But get out, try it, see what works, and then review what didn't work and improve on what did work as the design process. But yeah, designers are creatives, but the word design means to plan by and large, and that's all we do. We sort of go out there, look at the problem, review the problem, narrow down the problem, and then work out, well, okay, there's the problem. How can we deal with that? And then go through the process of action research to explore better outcomes and review that. So it's not the silver bullet, but it's going to be some kind of bullet that's going to help us get to where we need to. So.
Well, that's great. I mean, it's always like one step at a time, and then review, and then perhaps like redo things, and then keep moving forward. I think in our discussion now we have perhaps like highlighted several keywords here, starting with empathy, and then we have human-centric design. Then there is service design. Then there is action design. Uh, Again, going back to the perhaps like the premise of this discussion is we are starting up a new school of digital health, where the idea is to also bring these design elements into teaching. How do we teach our students on all these things? I mean, we need to teach them on healthcare, but we also need to add design to the course curriculum. Are there any kind of simple things that we can start off with, or is there any kind of a process on how do we kind of create the interest of design in the healthcare students, but also make them learn some small specific steps?
Yeah, it's in about 2012, 2016, the Victorian government, the state with which I live, asked me to sit in on a review of their year 11, year 12 high school curriculum in design and technology. So I had input, and the major input that I had was this design process. IDEO are strong representatives of that, iterating that process within the American sense. From the UK, it was the UK Design Council that generated a design process to analyse the process that designers go through to help them achieve what they achieve. But intuitively, I'm a creative. I'm a dreamer. My mother superior in my year 6 called me a little dreamboat. So I was always staring out the window and doing the work, but wasn't quite there. So that's what design does, and it's a multidisciplinary approach that is going to be the exciting part. That medicine has to let go a little bit and look for other views outside of the given hierarchies that within that profession. Other professions are starting to look at design too seriously, like law. So law are obviously under the pump with AI, the legal profession, and they've started to take on board outside influences like people from design to give them a new idea of how they can deal with this newfound technology that's going to move through. So medicine's in the same boat too with AI, and hopefully used for the better of the end. Well, they call it user. We call it your client or patient. By and large, it's for their benefit that hopefully the main aim of AI is going to resolve itself. So deep scanning technologies that can look for cancers or cell abnormalities and that stuff, which is difficult from the human eye perspective, but AI has got some benefits to it. So that's the good side. I've yet to see scenarios of the bad side for AI in medicine, but I'm certain that if you scratch the surface hard enough, you'll probably find some areas that are going to test that ethical nature.
Well, I think broadly, maybe a little bit of loud thinking here. I think design, at least from what you have mentioned, should be taught more as a hands-on experience by giving them some kind of open challenges, allow them to think freely, and then give their opinion, and then perhaps like discuss, and then iterate and keep going forward. So I think perhaps like that's one way that we can approach design education. And
Yeah,
I'm sure, like India,
learning by books is fine, and cramming for exams is good. But the design experience, design education, is project based or problem based learning. So that's the academic side of it. And with a design education, a 4-year undergrad, every subject uses problem based learning, project based learning, and they set a scenario and you come up with a solution and you go through the process. So the end of a 3 or 4 year period in undergrad, you're so well versed in this whole process, it just ignites with your creativity, and then you become a designer because you've learned that practice. So medicine needs to do the same. As I said, not so much cramming for exams to be able to regurgitate at one particular instance in time, exam time, the outcomes of your knowledge, and you get ranked based on that. It's really how you apply that knowledge and how it works within the field and out there in activity. So yeah, project-based learning is a key aspect to it. And I don't know that much about Indian education processes, but I'm assuming that it's largely based on the UK model of education. So, and that needs review as well.
well, sounds great. I think there's a lot that we can perhaps like work together on identifying these challenges, or perhaps like use cases where the students can come out with wonderful ideas. Um, in your kind of as a dreamer, as you mentioned several times now, how do you dream digital health is going to be? How is it going to transform the lives of people or patients? What's your imagination of digital health, Mark? More on the wild side,
I was
not
just
a.
sharing that demographic image with you of India's little valley of youth. So you've got a huge population of 24, 25, and I was suggesting that gerontology is probably going to be your main area of interest going forward as that valley of youth moves up and goes forward. You've got some major challenges with that volume of people coming through, and a progressive understanding of the nature of disease across various age groups to try and stay in front of it as best you can as that cohort moves through. And that's what you're seeing with obviously India is, what are you now, the fourth largest economy in the world, heading towards the third largest economy in the world. Mind you, there's a lot of people to share in that, but yeah, the demands in healthcare are going to be very very arduous on the Indian economy. So to doing it properly, doing it ethically, doing it with empathy is the key, I think.
Yeah, I guess so. In fact, like we also want to focus on longevity, and which perhaps is a slightly more consumer version of gerontology, which is the medical version of the same thing, I guess. Uh, or perhaps like longevity is more on a longer scale also. And I think design would definitely play not just a key role, but perhaps like a leading and a continuous role throughout the life course, throughout the healthcare services that are actually emerging up on the digital area.
What are you
It's
doing
been a very kind of.
exoskeletons? Japan has an aging population. They're trying to facilitate their workforce working longer, and they're using exoskeletons, robotics, and the like to assist people to work longer. So that's what I was saying about this young group that's moving forward. Are only going to get older, and they're going to need all of those assistants. So yeah, design and robotics, engineering alongside digital is enmeshed, and that's definitely going to be an exciting part of the next decade, I would say, within India now.
Well, it looks like it's going to be a very exciting future of design. Uh, digital healthcare and robotics, digital twins, all focused on empathy and human centricity, I guess, for healthcare. So I think there's a lot to process for one discussion. uh, yeah, well, thanks a lot for highlighting all these areas, and I really hope that we can perhaps like meet here again, continue the conversation. But as we are all connected digitally, I guess we'll still continue the conversation on the digital platform.
Yeah,
So thanks a lot for your time, and it's been like wonderful talking to you. But there's a lot of work to do alongside also.
it is indeed. Look forward to it.
Yes.